Hello, my name is Satvika Chalasani, and in this lecture, I will talk about the impact of sexual and reproductive health and reproductive rights as a public health priority. Good sexual and reproductive health is a state of complete physical, mental, and social well-being in all matters relating to the reproductive system. Every individual has the right to make their own choices about their sexual and reproductive health. To maintain their sexual and reproductive health, some of the critical things that people need are accurate information and a safe, effective, affordable, and acceptable contraception method of their choice. They must be informed and empowered to protect themselves from sexually transmitted infections, and when they decide to have children, women must have access to services that can help them have a fit pregnancy, a safe delivery, and a healthy baby. Family planning is an important component of sexual and reproductive health. It is central to gender equality and women's empowerment, and it is a key factor in reducing poverty, and the public health benefits of family planning are clear. Contraceptives prevent unintended pregnancies, they reduce the number of abortions, and they lower the incidence of death and disability related to STIs and complications of pregnancy and childbirth. Yet some 225 million women who want to avoid pregnancy are not using safe and effective family planning methods for reasons ranging from lack of access to information or services to lack of support from their partners or communities. Most of these women with an unmet need for contraceptives live in 69 of the poorest countries on earth. Girls and young women have the highest unmet need for modern contraception in many contexts. Increasing access to and information about modern contraception among adolescent girls is critical for protecting and improving their long-term health and for helping them remain in education. Family planning information and services are also essential for improving maternal and newborn health. In low and middle-income countries, complications from pregnancy and childbirth are among the leading causes of death for adolescent girls. And the babies of the youngest girls also face a higher risk of dying than the babies of older women. Yet adolescents face enormous barriers to accessing reproductive health information and services. Such access to information about sexual and reproductive health and reproductive rights is central to achieving gender equality. When women and couples are empowered to plan whether and when to have children, women are better enabled to complete their education, women's autonomy within their households is increased, and their earning power is improved. This strengthens their own economic security and well-being as well as that of their families. Cumulatively, these benefits contribute to poverty reduction and development. There are clear economic benefits for investing in family planning. For example, for every dollar invested in contraception, the cost of pregnancy-related care is reduced by $1.47. Family planning can also help countries realize a demographic dividend, a boost in economic productivity that occurs when there are growing numbers of people in the workforce and falling numbers of dependents. The regions with the greatest need for modern contraception, Sub-Saharan Africa and South Asia, would see the greatest health and welfare gains from meeting unmet need. Greater health and economic benefits can be gained by integrating family planning with maternal and newborn care as well as HIV and STI services. It would cost just $25 a year per woman of reproductive age to provide such a package of reproductive health services, which is roughly double the current level of spending. But improving health outcomes requires more than the provision of reproductive health services alone. People who need the services most are often least able to access them. Thus, services and information must be delivered in ways that respect, protect, and fulfill the human rights of everyone who seeks or uses them. Improvements must be made in both the coverage and quality of services to have the greatest impact. In summary, The progress achieved over the past decade in reducing maternal, child, and AIDS deaths demonstrates that it is possible to dramatically improve health in the poorest countries. However, much more work remains to be done to reach the poorest and most vulnerable people. With sufficient resources and political will, the poorest women and families will see substantial gains from additional investments in reproductive health, especially family planning. And nations as a whole will see greater progress towards achieving their development goals.